Hello and welcome. If you're here, it's likely because your vet has recommended a hepatic diet for your dog, or you've been searching for answers about liver disease and how nutrition can help. Either way, you're in the right place. I'm Dr. George, the in-house vet here at Wunderdog, and today I'll walk you through how liver nutrition works, why early support matters, and how our hepatic recipes are tailored to different needs, whether it's copper accumulation or advanced protein sensitivity. Liver problems are more common than many realize. Around 12% of chronic disease cases in dogs involve the liver. And certain breeds like Labradors, Dobermans, and Bedlington Terriers are genetically predisposed to copper storage disease. The liver is the body's detox powerhouse. But once it's overloaded, you'll see signs like appetite loss, weight changes, vomiting, jaundice, or even neurological symptoms. That's why nutrition isn't just supportive, it's central. The right diet reduces copper buildup, manages protein waste, and helps protect and even regenerate liver tissue. Many owners believe medication alone will stabilize liver disease, or that cutting out protein is always the solution. Others don't realize that copper can be a hidden driver of damage. Here's the truth. If you wait until a dog shows late-stage signs like ascites or hepatic encephalopathy, we've already lost a lot of liver function. Early intervention buys time. In copper hepatopathy, excess copper builds up inside hepatocytes, the liver cells, producing oxidative stress that scars the liver. Restricting copper in the diet down to around 0.1 milligrams per 100 kilocalories and supplementing with zinc can limit absorption and slow this process. In protein-sensitive dogs, the goal isn't to remove protein completely, but to reduce total load while keeping it high quality. Too much protein leads to ammonia buildup and some neurological signs, but too little causes muscle wasting and weakness. It's about balance, feeding enough digestible protein to maintain lean mass while limiting waste products. Micronutrients matter too. B vitamins, selenium, and antioxidants, they reduce oxidative stress. Sodium restriction helps limit fluid retention, and taurine supports hepatocyte health and bile flow. So, early action matters because the liver can regenerate if we lower its workload before irreversible damage occurs. The right nutrition protects the organ, slows scarring, and extends both lifespan and quality of life. Here at Wunderdog, we usually explain hepatic care as a circle with three connections that support each other. The first connection is veterinary care. Liver disease can look very different depending on whether it's copper hepatopathy, chronic hepatitis, or advanced hepatic encephalopathy. That's why diagnostics matter. Blood work, especially liver enzymes like ALT and ALP, can show us if the liver cells are stressed. Bile acids and ammonia level tests help detect toxins in the bloodstream. Ultrasound and, in some cases, biopsy confirm the diagnosis and stage. Based on this, your vet may prescribe medications to improve blood flow, ammonia absorption, and protect against oxidative damage. Then comes your role in home care. You're the daily observer. Early warning signs can be subtle: reduced appetite, changes in stool color, increased drinking and urination, or even small shifts in behavior such as restlessness, disorientation, or changes in energy levels. Documenting these changes and reporting them quickly gives your vet the chance to intervene before a crisis develops. And there's nutrition care. This is where every single meal becomes part of therapy. Food can reduce copper accumulation, lower ammonia production, support hepatocyte regeneration, and supply antioxidants that medications alone cannot cover. It's the daily foundation that works alongside your vet's treatment and your careful monitoring at home. When these three connections align, we give the liver the best chance to stabilize, regenerate, and protect the rest of the body for years to come. So, how exactly does nutrition help prepare the liver? Let's break it down from a medical standpoint. First, copper control. In copper-associated hepatopathy, every milligram matters. Studies show that affected dogs should remain below 0.1 to 0.12 milligram of copper per 100 kilocalories to prevent further accumulation. Excess copper generates free radicals and damages hepatocytes, accelerating fibrosis. That's why copper is restricted, while zinc is supplemented. Zinc competes with copper for intestinal absorption by upregulating metallothionein, which binds copper and prevents it from entering circulation. Over time, this can reduce hepatic copper stores and slow disease progression. Second, protein balance. The liver is central to nitrogen metabolism. In early to moderate disease, dogs need around 4 to 5 grams of protein per 100 kilocalories from digestible sources like turkey or camel. These proteins supply essential amino acids for lean mass and immune defense. In advanced disease with encephalopathy, we reduce the protein, but we focus on highly bioavailable sources, so the dog still gets the amino acids needed for repair without overwhelming the liver with ammonia and urea. Third, micronutrient support. Taurine and methionine aid bile acid conjugation and detoxification. Selenium and vitamin E act as antioxidants, protecting hepatocytes from oxidative stress. B vitamins, especially B12 and folate, they are critical for DNA synthesis and hepatocyte regeneration. 4. Sodium control. Excess sodium worsens the portal hypertension and ascites. Keeping dietary sodium near 0.08 grams per 100 kilocalories helps reduce the fluid buildup, improving comfort and respiratory ease. And finally, fiber and gut-liver balance. Soluble fibers from pumpkin, oats, and sweet potato ferment into short-chain fatty acids, which reduce ammonia absorption in the colon and support a stable microbiome. Since the gut and liver are directly linked through the portal vein, stabilizing one directly benefits the other. This is why nutrition is more than supportive. It reduces hepatic workload, slows scarring, and gives the liver a real chance at regeneration at the cellular level. This is why we developed 2 distinct hepatic recipes. Wundercare+Hepatic Copper Restricted is formulated for dogs with copper-associated hepatopathy or chronic hepatitis. It uses novel proteins like camel and turkey, with copper levels limited to 0.13 milligrams per 100 kilocalories, and fortified zinc, taurine, and antioxidants to actively protect the liver. Wundercare+Hepatic Protein Restricted is for advanced cases, dogs with hepatic encephalopathy or severe fibrosis. Here, protein is reduced to around 6 grams per 100 kilocalories, but it's highly digestible from sources like turkey and duck, providing essential amino acids without excess nitrogen. Micronutrients like selenium, B vitamins, and taurine are enriched to support detoxification and repair. Both are gently cooked, lab-tested for digestibility, and designed to complement medical therapy. No fillers, no preservatives. Just precision nutrition for liver health. Dogs with liver disease often need slower, more careful transitions. Their metabolism is fragile, and sudden changes can worsen appetite loss or digestive upset. For stable dogs, we recommend a 14-day crossfade. Start with 25% new hepatic recipe and 75% of the old diet. Then increase gradually every 3 to 4 days until you reach 100%. For fragile cases, especially those with protein restriction, go slower. Extend each stage to 5 to 7 days for a total of 21 days. Monitor stool consistency, appetite, and energy. If stools soften or appetite drops, hold at the current level before progressing. Monitor very closely your dog's stool quality and try to aim at 2 to 3 on the 7-point scale. Also, your dog's energy and appetite stabilize and improve, while neurological signs like disorientation or head pressing in advanced cases, if these occur, consult your vet immediately. A teaspoon of soluble fiber like pumpkin puree per 10 kilograms of body weight can help smooth the digestive transition. The goal isn't speed, it's stability. A slow, structured transition helps the liver adapt and ensures the therapeutic benefits of the diet are fully realized. Day to day, consistency is everything. Feed measured meals by weight, not volume, at the same times each day. Avoid high copper foods like organ meats, shellfish, or certain treats. And never add supplements without checking with your vet. Even something as simple as a multivitamin can contain copper or protein levels that work against the plan. For protein-restricted dogs, smaller, more frequent meals are best. They reduce the post-meal ammonia surge and keep energy steady. For copper-restricted dogs, exclusivity is key. Even small off-diet treats can undo progress by adding hidden copper. And here's the golden rule. Don't ignore subtle signs. A small drop in appetite, changes in stool, or increased lethargy may seem minor, but they can signal that the liver is under strain. Early reporting to your vet allows adjustments before things worsen. The good news? With the right veterinary care, your careful monitoring at home, and precision nutrition through Wundercare+Hepatic, dogs with liver disease can live more comfortably for years. And remember, you don't have to figure this out alone. Once you start your care pack journey with us, you can always book a free consultation with me. Together, we review your dog's history, answer your questions, and tailor their nutrition plan so you feel confident you're giving them the best possible support.